The Susan Brender Show is a radio show online broadcasted on YouTube across the United States and globally. The show features guests who speak about health, spirituality, entertainment, and a host of subjects to enlighten people across the nation. Listen to the show that empowers women and men alike and highlights those who have made a difference. I'm Susan Brender, and this is the Susan Brender Show. Dr. Jeffrey Stanger of Stanger Injury Centers offers medical and chiropractic care to patients injured in auto, slip, and fall workplace accidents. Specifically, Stanger Injury Centers provides a broad range of diagnostic and therapeutic services to assess, document, and treat patients who have been injured in automobile, slip, and fall and work-related accidents. And I want to welcome Dr. Jeffrey Stanger to the Susan Brender Show. It's a pleasure to have you on, Dr. Stanger.
Thanks for having me, Susan. Pleasure, my pleasure. And you did a great job of introducing.
Now, let me ask you something. Stanger Injury Centers provides comprehensive diagnostic and treatment service to victims of auto accident injuries. How does that work?
Well, we've been in Delray Beach for, almost 40 years, helping the injured. And we've assembled a great team for that purpose. Our specialties include pain management. We have a DPT, which is a doctor of physical therapy, as well as 2 chiropractors at this Delray Beach location. We speak Spanish, and we are very user-friendly and helpful to those who have been injured.
How do people find you, Dr. Stanger?
We have several resources to help get the people who have been injured into our office and find out about us. One is an online presence. We do a lot of social media. We also, since we're in town for so long, we know all the best attorneys. And may I add also the attorneys to avoid. So we're a good resource for that, should you need an attorney. And also referrals is a big part of our practice. And those who have had great service recovering from their accident injury oftentimes refer others, friends, family members, and neighbors who have been in accidents because they enjoyed the experience here. And believe it or not, when I say enjoyed, they actually get better, feel better, and that's why they enjoy coming to Stanger Injury Centers.
How often do they have to come, Dr. Stanger?
Depends on the severity of injury, but on the average, between 2 and 3 times a week for the first 2 to 4 weeks. Then we do periodic progress exams to determine future need.
Now, Florida's car accident epidemic, and why is that?
Now, that's a good question. That was going to be one of my questions. We have an unusual mixture here. We have seniors. We have people, but lots of young people just out of high school or in high school, and the driving age here is 16. And then we have everything in between, commercial truckers, people in a hurry. So that leads to a lot of accidents.
Now, let me ask you something. If they don't have an accident, but they feel bad, how do they contact you?
Well, we have 2 wonderful websites that are very user-friendly. One is called StangerHealthcare.com. And the other one's called Stanger Injury Centers, plural.com. Obviously, one is dedicated to health and wellness for those who have not been in an accident. And the other one is for those who have been accidentally injured, whether it be by automobile, slip and fall, and sports injuries for that matter as well.
Now, what should I do if you're in a car accident? That's a question that is very important, because if you're in a car accident, some people don't know what to do after that.
Susan, good question. Another good question. Really, most people don't know what to do. They panic. They get anxious. They are not sure what to do. So our recommendations are, first of all, make sure everybody in the car and yourself are okay, not bleeding, nothing seems to be broken. You probably if you don't feel great and there was a significant impact, you should call the police and the EMT, that's emergency medical technicians, so to check you out to make sure that nothing life-threatening is happening. And then, with that said, take pictures of the accident, of the parts of the car that were impacted, both your car and also the other car.
Now, if people have to go to the hospital, do you go to the hospital to visit them and recommend your place?
If they would like us to do a visit, yes, and we're certainly open to that. Most of the time, the hospital is to the ER or to a walk-in center, and they are evaluated and discharged. And that's usually when we have our first contact with that injured crash person.
Now, what should you look for in a doctor who is an injury doctor?
Well, first of all, make sure they have lots of experience treating accident victims because it's very specialized. You want to know what injuries to look for, both obvious and not so obvious. You want to, your best way, the most convenient way to choose a doctor is one who does multiple services, so you could have one-stop management of all your accident injury treatment needs, and we provide that service.
And if people want to consult an attorney, what do they do about that? Is there an attorney that you like the best?
Well, it depends. Attorneys, like everybody, like a doctor, specialize in different kinds of accidents. So depending upon how the patient presents, we then determine, if they ask, who we feel would be the best attorney for their case. And the reason we are pretty knowledgeable in that area because of the amount of time we have been in the area helping the injured.
Now, the area that you're in is Delray Beach, Florida. Do you extend your place if somebody has an accident, say in Boca or another place? Do they come to you?
Yes, we find that the average circumference from our location on Atlantic and Congress and Delray Beach is about 5 to 7 miles. You don't want it to be too far because it requires repetitive treatment. And if it's too far, the injured client patient will not treat on a regular basis and won't get the desired results that they're looking for.
This is a biased question because I see you too, and I think that you're the most wonderful doctor, but there are other doctors that do what you do. So why did they come to you?
Well, one main reason is experience. We certainly know how to handle an accident injury case and the proper evaluation and treatment of. Another reason is our staff treats everybody who comes here as a new patient like family, makes them very comfortable. And if in fact there's an attorney involved, we have direct communication with the attorney. So the attorneys love us because we're very responsive to their needs and requests.
Does Medicare pick this up?
No, there's specialized automobile insurance called PIP, personal injury protection. And if your injuries are caused by an automobile accident, that becomes primary. If at the end of the care, the PIP has been used up and you only have a certain amount available, then we accept Medicare as well, and we are in network.
Now, how long can a treatment take, Dr. Stanger? Because when you're in an accident, sometimes it is very bad, and I wonder how long it takes to really get better.
It can take anywhere from 10 weeks to 14 or 16 weeks, depending on the severity of the injuries.
What was the most severe person that you ever saw?
Well, we generally, upon presentation, if we feel there's a concussion or a possible brain bleed, we get the MRI done if they haven't been to the emergency room or walk-in center to help us determine whether or not they need other type of specialized care like orthopedic surgery, or neurosurgery. And by the way, we also have relationships with a network of orthopedists and neurologists and neurosurgeons that we've established over the years that are very responsive to the injured patient's needs.
Now, explain to our audience what's involved when you have an accident or any other treatment that you do. What kind of treatments do you do?
It's more comprehensive than the typical health and wellness treatment because it includes usually traction. We also, once we get you out of pain, we also have a rehabilitative exercise program to strengthen you so that you don't sustain future injuries. And we try to get you back as close as possible to pre-accident status.
Now, what is your physical therapist? How do you get involved?
Once the person is out of acute pain, so they can start the rehabilitative process, he directs their recovery through various specific exercises depending upon the body part. And one of his specialties includes extremities, shoulders, hands, and knees, as well as ankles.
Which is the most popular one?
Well, knees and shoulders seem to be injured quite often in an accident because of striking objects in the car. And after that, probably elbows.
Right. Now, here's the thing. Most people have back pain caused by many, many different things. Can you explain that?
Yeah, sometimes people come with pre-existing conditions that make them more vulnerable to a new injury. And so, because of that complexity, it makes the recovery time that much longer.
Right. Now, if you're in an automobile accident, go through it again and tell our audience what they have to do to see you and get better.
I could do that. First off is making sure you do the right things at the scene of the accident, which includes pictures and exchanging information if the police aren't on site. Otherwise, they'll do that for you. The EMTs are often called, and you have to decide if you want to be transported to a walk-in center or an emergency room. But remember, you may end up there and for hours sometimes because of the amount of people that go through the emergency rooms. And then after that, you want to choose an injury treatment doctor that has great reviews online because that seems to be one of the ways people go these days to choose their service provider. And you could also ask other family members and or neighbors and friends who have been in accidents who they would recommend because they've gone through the experience already.
Now, things are very technical today. So how do people get in touch with you if they want to go on Facebook or any other social media?
Well, just click on the particular social media, TikTok with videos more, but Instagram, Facebook, and type in what you're looking for and we'll appear because we have a presence on all those social media stations.
Right. Now, if people want to get in touch with you again, how do they get in touch with you, Dr. Stanger?
The old-fashioned way is to call 561-498-4300. That always works. We have a great team of front desk people that could immediately sometimes even create a same-day appointment. Social media we mentioned, and also there's a response tab on each of our websites that allows you to connect directly and even make appointments.
Right. Now, there must be something that you want to say that we haven't really asked you yet. Is there anything that you want to tell our audience?
Yes, a couple of the main things because of the specialized nature of accident injury. In fact, if you call your primary care doctor, PCP, more times than not, they'll tell you to go to the emergency room or a walk-in center because they don't handle that type of accidental injury. It requires specialized billing and specialized knowledge on how to evaluate. So you're better off contacting us directly, or ask the PCP if they know of an injury doctor that handles lots of accident injuries and has a large number of years of experience doing so.
Now, chiropractic is a very specialized thing. Are young people getting involved in it?
Yes, in fact, what I've read in the journals is that there's chiropractic profession is booming. In fact, it's soon to be included in the Medicare program completely. Right now, you only get reimbursed partially, but they're going to start reimbursing us for anything we're allowed to do under the scope of our licensure. So Medicare right now pays only for what we call an adjustment or manipulation, but there is legislation pending to allow us to provide all the services that we're trained for, such as taking x-rays, consultation, evaluation, and exam, physical therapy, and just to name a few.
That's great. So I want to thank you, Dr. Stanger, for being on the Susan Brender Show. It's really been a pleasure and very educational. So thank you again.
Pleasure's all mine, Susan, and it's great that you have a great show, and I enjoy being on it.